Thank you. I'll talk about ischemia reperfusion injury, which happened in many organs, such as when the stroke. My laboratory studied this topic using model mostly in heart, skeletal muscle, and intestine as well. We haven't getting to the brain yet, but there are some other group working on this area, which I will sort of use a slide to summarize what we know in the area. From view, there are two views from regarding the ischemic reperfusion injury. One is the cell biologist thinking about the oxidative stress cause all the problem, cellular changes, eventually lead to the cell death. But as an immunologist, I was trained as an immunologist. We summarize what we know. It's a signal, generated danger signal because the cell get modified during hypoxia, and those signals recognized by the immune factor. My laboratory studied complement, innate immune factors throughout the years, and there are many other players as well. They play a role in generate immune attack. Essentially, from immunologist view, ischemia, which is blocking of the blood flow, then followed by the reperfusion, which is flowing of blood by removing the clot or anything blocked blood flow. Bring the immune factors that cause immune response, essentially the sterilized inflammation response. So, as I mentioned, my laboratory studied complement, which is part of a major part of the innate immune system. There are about 40 factors in the whole complement system. And they were organized a very neat way. Actually, three major pathways has been known. Working together, lead to central molecule C3, then followed by down to the common pathway, the number of molecules. So, as scientists, we have been using knockout animals, different knockout animals for complement factors has been available, and to study how removing those some factor can that delay or maybe prevent the reperfusion injury. In the heart model, my laboratory has studied, and we also use intestinal model, skeletal muscle model as well. And as we know, in heart attack, the block of a coronary artery, then cardiologists often have a way to remove the clot or have a stent to bring the blood, reperfuse the previously ischemic area, as to prevent infarct. This is quite acute. So, in number of complement deficient animal, or using complement inhibitors, scientists and my laboratory as well have shown that the infarct size of heart can be reduced, or even subsequently some function can be nearly fully restored. So that changes the whole landscape of how as a basic science to view this how ischemia reperfusion can be targeted by inflammatory response through the complement. But the story is not that as simple. By targeting complement, remove it away. Clinical trials, the number of clinical trials have been conducted, but none of them are conclusive. There obviously that tells us immune response through inflammatory through complement maybe just part of the story. There are two sides, as cell biologists meaning has pointed out. The apoptotic pathway may be important as well. Maybe it's not just one single drug is able to do all the thing. Maybe has to throughout the stage as disease progress and certain drug need to be applied. Maybe complement is at certain critical stage. My laboratory is currently working on to investigate which factor because this is a cascade of the protein play a role in the whole inflammatory response, and which stage maybe certain factors play a role. So maybe earlier maybe cellular factor, later on inflammatory response to complement play a role as well. So. So looking at, I know this is the brain summit. So my laboratory hasn't worked on the brain, but we are really aware of the literature publication in the field, and there are scientists, the groups using the knockout animal of complement system, particular MBL nectin pathway, the earlier molecular nectin pathway, and they show that by remove MBL. The animal has a less infarct, so as their neurological function get improved afterward, and by histologically actually deposition of a downstream complement activator, for instance C3, has been significantly reduced. So as we can see that immune system through complements. They do play a role in causing the damage to the brain after ischemia. If this could be interesting to in stroke, future probably stroke or MI heart attack treatment as well. So as not like so single drug probably in addition to the current therapy, at certain stage, maybe physician could think about, to prescribe some complement factors if they detect a certain inflammatory indicator or biomarker that complement get activated, then just at a certain point give a target treatment. So this is my take from immunologist view, how ischemia reperfusion injury could be helped by immunologists. So I give here. Thank you.